man right here, our good buddy, Dr. Carlos Rodriguez. It's our weekly Evara Health Injury Report. Doc, so thankful for you to join us here. And how was your vacation, my friend?
It was a great time. We went up to North Georgia to the mountains up in Blue Ridge. So it was a fun time with the family.
Mm, beautiful. And you well deserved, Doc. Well deserved. Did you go to the game last night, Lightning game?
No, I did. I couldn't go last night, but I did watch it on TV.
Saturday night's going to be crazy, man, against the Florida Panthers. So make sure you tune into that one as well. Doc, we got some good news. And we've been going back and forth about Bucky Irving and Chris Godwin the last couple of months now. And kind of we'll start with Chris Godwin. The unsurety of what's going on with the fibula. And again, we don't know all the information, but the fact that they said was the fibula, you and I have discussed that probably have something to do with the hardware north and south of where he had that hardware on the fibula. Now that he started running again and we see him out there with his team, when you look at it, how many steps of how many processes does he have to go through? Because they're not taking hits in practice. So, I mean, is this one of those things where if he's running, then you would assume that he's in there on Sunday? Or do you think this is kind of a step in the process? It's kind of hard not to know without talking to them. But where do you think we are as far as the recovery process with Chris Godwin if he's out there running after not even doing anything with the team the last couple of weeks?
Yeah, I mean, seeing him out in practice and running is a great step in the right direction. The main thing at this point when you're having them start to run, start to exercise, is making sure that he has no pain and no significant issues as he's running, cutting, doing all the motions. Then after that, you have him do a full practice, right? So it's not just warming ups, but seeing him take a full practice with some hits and some more game time movement, that would be key. If he has no issues, no problems, once you put him through a full practice, then you will see him in the game. Seeing him doing some running is encouraging, as making sure that he doesn't have significant amount of discomfort, pain, or problems, or that whatever issue he was having does not recur as you start stressing the bone again. If that's the progress is made in the right direction, then I don't know if we will see him Sunday. Not having seen him through a full practice and a full workout would be difficult for me to say that he would be there Sunday, but it's a step in the right direction. And if not this week, then I would say definitely next week.
So we found out from Bucky Irving, and we discussed the foot injury and the shoulder injury as well. And from what we've heard, it looks like the shoulder injury was really the one that kind of helped, hurt him and kept him out for longer. Same thing with him, right? I mean, good to see him back out there. Are you worried more about the physical contact when it comes to Bucky because of the shoulder injury?
Yeah, I mean, the main thing, and I think they mentioned it in the press conference, was basically they want to make sure he can take a hit.
Yeah.
So with the shoulder, my thinking is he's dealing with an AC joint injury, so a kind of upper shoulder part here, just a separation there. And you got to make sure he's able to take a hit. You can put some padding, you can put some extra padding there in the shoulder pads just to make sure he's doing okay. But is he going to be okay once he takes a hit, right? Does he drop the ball? Is he not able to hold the ball because of the pain makes him loosen up his hands? So if he's able to take a hit, and then you have to put him through practice to be able to see that. So seeing him running, takes some movements, taking some snaps is a good thing, taking some handoffs. But you got to put him through some impact. If he's able to tolerate impact, if he's able to tolerate hitting, then yes, he should be able to play. I don't know if they'll be able to do that today, tomorrow. If they put him through that and he's doing okay, then we'll see him Sunday. I'm a little bit more hopeful that he'll be there Sunday for the game, making sure that he can take the impact and be able to take a hit.
Yeah, and that's the tough point of this time of the season, Doc, is no pads this week, the Buccaneers have said. It's all walkthroughs. It's all, unpadded. And that's kind of the tough part of the season, right, Doc, when you get to football, because now you're sitting here 9, 10, 11 weeks into the season. You got guys that are banged up. You definitely want to be ready for the physicality on Sunday, but you also have to be aware that these guys are not near 100%, and you have guys on the mend. So that's something that's kind of like the balance, right? When we're talking about sports, especially football, because it's so physical that sometimes you have to know kind of when to pull back a little bit, right?
Yeah, I mean, and it's a big game on Sunday because you're coming off a loss with the Patriots. So, do you put all your chips on the table right now for this game, or do you say, you know what, we'll let this one go, and then we'll worry about future games, so maybe more crucial to win the conference later on and make a good playoff run. So it may be one of those things that I think they're running them, they're seeing how they're doing. Maybe it's just a matter of running them this week, putting them through a good practice next week, and then after that, we'll see if they can play a game.
Let's talk about some Lightning hockey players now. Dominic James, saw what happened to him. What a crazy situation there. They put him on IR, which was retroactive to the game last weekend, and he ended up finishing the game. But what did you see from that situation? Because he went right off the ice. It was kind of tough, and thank goodness, because I remember growing up, seeing some very scary things that have happened. Guys have almost lost their eyesight, and now, unless you're grandfathered in, and I only think there's 4 or 5 guys in the NHL that don't have the half visor now. That's something that is mandatory, unless you're one of the few guys that doesn't have to wear it because you were there before it. But man, what do we know about Dominic James? Because I think people were a little surprised that he ended up going on IR because he ended up finishing that game.
So I went back and looked at the game again. I had it recorded, so I went back to look at the game, and the puck catches him flush right on the cheek and right on the face. And you can see when he actually comes back, if you watch him on the bench, it's already swollen, it's already red right here over the face. So, I mean, you walk right off the bat because, I mean, when you get hit with that puck, I mean, you feel like your face is smashed, right? Yeah. So he walks into the locker room, they probably check and make sure the arch right here, what we call the zygomatic arch, which is part of your lower orbit, it's okay. Make sure the jaw is also okay. The maxilla right here, make sure all that it's okay, that there's nothing there that makes you think there's a fracture. He does come back and actually goes through another 6 to 8 shifts, I think, before he goes back out again. And I think at that point, it's just the fact that it's getting more swollen, more painful. And at that point, you're thinking, let's make sure that you're not going to suffer another hit, another injury there, and we compound the problem. Now, him going into IR, the question is, did they do an X-ray? Did they see something on the X-ray and they saw, is there a fracture? Is there a chip? If there's something going on at the facial area, that would make it more cautious to be able to keep him out a little longer to make sure that heals up. Or is it just mostly a bone bruise? There's no fractures, and it's a matter of pain tolerance, the pain going back, the swelling going down, and making sure the eye is okay.
Is that what is? Can we? I mean, it's tough to assume and it's tough to speculate, Doc. But that's what I'm thinking. I'm like, man, we've seen guys before. Eric Chernak, he was wearing the full face mask for a while. Can we kind of assume and speculate that there's a fracture there because he's on IR? Because you would think if it's just something that's, I don't want to say cosmetic because I don't want to downplay it so much, but if it's more of just a pain tolerance thing, that he would probably tough it out, right? It seems like it might be a little bit more serious. Is that, I know it's hard to speculate.
Well, I mean, the arch is pretty hard bone, especially the way it's shaped. It's a hard bone to break. You need a really big impact. I mean, a puck can certainly do that.
Yeah.
So is there a possibility that there is a fracture there? It is possible, but I would be thinking if there is a fracture there, they'd be thinking he may need surgery because usually those zygomatic arch fractures may need a plate, may need a surgery, and then you're looking at maybe the season could potentially be over, or he's wearing, after surgery, a big shield to protect the face. My thinking is there's quite a bit of swelling there, and that's going to affect your peripheral vision, right? He's probably got a big swollen area under the arch here. That affects your peripheral vision. That affects your ability to see the puck and do what you need to do in such a high hand coordination type of game. So I think it's more of a caution more than anything else.
Okay, good.
If they had an inkling that he had a fracture, I don't think he would have come back to play right after the injury. So I'm thinking they didn't think he had a fracture, so that's why he came back and played.
Okay, good.
But I think right now it's just the amount of swelling is there. It's probably too much for him to be able to go. And they're waiting for that to go down before he can play again.
All right, how about Ryan McDonagh? He's one of the toughest guys that we're ever going to see. He blocks shots for a living. This guy is just such an unbelievable player and human being, and it's weird to see him out. You know that if he's out and he's injured, that it's not – it's something at least decently serious. What do we know about Mac Truck?
So watching the tape, it's right at towards the end of the first period. He goes to block a shot and catches the puck right on the outside of his left leg. So right around the ankle area, at the outside of the leg. We talk about the fibula. That's the little bone sitting there. So you always worry a puck hits that area. Can the bone break? Certainly can happen. But I'm thinking mostly it's a bone bruise in the area. So we're looking at maybe a couple of games out, let the swelling, let the pain go away, make sure he's able to skate, put a boot on, lace it up, and make sure that it's not too painful to skate with the boot on. So if he's able to do that, I'm thinking I don't think he's going to be there against Florida. I don't think he's going to play this weekend. I think they're going to give him the time to recover from that injury. But looking at it, I think it's more of a bone bruise, a pretty nice bone bruise around the ankle area on the outside.
Yeah, and that's the kind of the crazy thing when you're looking at hockey. You have all these pads on, right? And you're like, oh yeah, you can play. And then it always seems to find like that little area where there is no pad, which is kind of crazy. And you look at certain situations where, I mean, putting on a skate sometimes, Doc, has got to be so excruciating when some of these guys are dealing with injuries, right?
Right. I mean, and you play hockey,
yeah, buddy.
And the boots are tight. Hockey boots are pretty tight.
Yeah.
And if you have a bruise around your ankle and it's right where the boot's going to press, it's going to be very painful. So you have to make sure that the amount of pain is tolerable and you're able to put the skate on. Make sure that there's not enough swelling there. I mean, that can also get in the way of you putting your skate on. So making sure the swelling goes down and then be able to skate without any discomfort and be able to play the game without any issues.
Doc, random question, because it happened to me one time and I went right down. I was trying to block a shot and I put my stick out and the puck almost like ramped up off my stick and it hit me right in the throat and I went straight down. And I see injuries like that before, and I'm almost surprised the neck guards are not mandatory, but we've seen some injuries in the past where guys get hit there. What's the initial mindset for a trainer when a guy gets hit in the throat like that? Because I think about it, and I got hit in the throat. It wasn't as bad, but I often think like, man, what if that's a puck? What if that's a 90-mile-an-hour shot? Like that could collapse everything, and that you'd have to worry about breathing techniques. What are some of the things that you're looking for initially when something like that happens?
So, I mean, neck injuries are very crucial and critical, especially if you take a puck straight to the neck at that speed. I'm worried about a fracture to the trachea, but mostly I would be worried about the swelling that's going to happen. That's going to compress your airway. And that's the big issue with a neck soft tissue injury. When you get hit right here on the neck, is that things are going to swell up. And they can swell up to the point where it cuts off your breathing. It cuts off your airflow because the swelling is so tight that it closes off your airway. So if there's any suspicion or inkling that the injury is severe enough that the breathing is going to be compromised, immediately you got to think about intubation. Immediately you got to think about maintaining an airway before you lose any access to it, and then you have to do surgery to try to open up basically an airway, do what's called a crike or a trach to basically open up the airway. So if there's any suspicion or inkling that is such a severe injury, you start seeing the swelling, you start seeing the bruising around the neck, you have to start thinking about immediately removing the player and doing sedation and maybe an intubation to prevent losing the airway.
Unbelievable, man. I think about it like people talk about like pressure points. And is there any other, and I know this is like a random question, but are there any other parts where we have to worry about, like if a person takes a bruise in a certain spot that we have to worry about like breathing issues or blood issues getting to the heart? Because, we talk about like when people do like stuff, like when they put something on their wrist, you know what I mean? Like it stops the blood. Like I think about that for hockey, like, are there any other spots where guys really need to be concerned about when it comes to like blocking a shot where they have to think maybe outside the box, it could be worse than initially thought?
I mean, that certainly it's the throat. I mean, here is critical. Not only being hit by a puck, but slashed by a skate. And we've seen that happen. I mean, you get slashed right around the sides of the neck here, your carotid, your jugular veins are running right through there. And it's a deep enough cut. Those are major vessels. So there's going to be a lot of bleeding going on. You got to control that. That's an emergency. You got to make sure that you get the person to the hospital, control the bleeding, and there's surgery that needs to be done to immediately repair the blood vessels. So this area here is very critical. Other than that, Nothing else is really going to cut off your air supply,
Right.
unless you drop along, right? If you get hit in a certain way and you drop along from the impact, break ribs, the ribs dropped along, I mean, you're going to feel short of breath. You're going to have trouble breathing. If air starts accumulating in your chest and starts causing what we call a tension pneumothorax, which is basically the air starts causing the chest to start shifting because of the pressure on that side where the air is accumulating, that can be an emergency, because that can cut off circulation through the system, circulation to the heart, circulation through the lung area, just because of the tension, and starts also pushing your trachea and your airway off to the side.
Wow.
So that is also an emergency if you identify that the person has a tension pneumothorax. If the pneumothorax is just not causing any tension, it's usually not a big deal. You just got to eventually put a tube in to get the air out. But the tension pneumothorax, so chest impacts will be important, neck impacts will be important. When it comes to the extremities, you're really not going to affect the central circulation.
Right.
You can certainly affect the circulation to the extremity itself.
Mm-hmm.
And we worry about injuries that cause something called compartment syndrome, which is basically significant bruising to whether forearms or it's the lower leg. And then when the compartments start increasing, the swelling starts increasing and overcomes basically circulation to the tissues in that compartment, then you have significant tissue loss and damage, and you have to open those compartments up to reestablish circulation.
Doc, as you're talking, I just punched in Oliver Bjorkstrand because I spoke to him yesterday, and he was ruled out April 11th last year and was out for the rest of the season because of compartment syndrome in his left thigh. And I've never asked you about it, and I got a chance to talk to him yesterday. And before you even finished your answer for that last question, you brought up compartment syndrome. That's why you are the best. And for those who don't know, a serious condition that occurs when pressure builds up within a muscle compartment, restricting blood flow. This condition can lead to permanent damage if not treated promptly. And Doc, I didn't get a chance to see it, but our good pal Eric Erlinson from lightninginsider.com said there is a scar that is running like up his side because of how bad it was, and it kept him out for so long. And you know, it's usually a week-to-week injury from everything that we were reading up, but man, he didn't play at all, and he had that compartment. That's got to be scary because you're feeling a lot more pain than you think, and you're like, that's just a normal hit. I mean, that sounds pretty scary, Doc, because you know it's a physical sport. It doesn't seem like it's a bigger hit than anything else you took, but I mean, thank God that he went to go get this checked out, because this, I mean, what kind of damage could be really done if like you don't get compartment syndrome taken care of?
No, it can be significant neurovascular damage and loss of tissue, loss of function.
Wow, man.
So basically in this compartment, so essentially what happens is you have a group of muscles, and those muscles are usually encased in fascia, basically in a lining.
Mm-hmm.
For example, the lower leg below your knee has 4 different compartments. So at any point, and there's blood vessels and nerves that can travel through some of those compartments. So every compartment has nerves and vessels that are critical running through them. So what happens is when the compartment gets hurt, swelling starts occurring within the compartment. If the swelling is not controlled, eventually the swelling overcomes the circulation to the tissues, basically overcomes your circulation or your blood pressure.
Right.
As the circulation is cut off, now you got anoxic injury. There's no more circulation. The tissue starts dying off, which compounds the swelling. So if you don't immediately relieve the pressure in the compartment, and the way we relieve the pressure is basically opening the compartment up. So that's the big scar. So basically you go in, numb the area, and you slice the compartment. You slice the compartment open.
Oh my
God! So that relieves the pressure. But now you got all these tissues that are swollen. Basically, they just pop out, right? So now you got to wait for the swelling to go down to be able to get the skin and the tissues back together,
right,
to be able to close it. So when we see this, and you,
how long is that? How long do you keep that wound open?
You got to wait until you're able to approximate the tissue to close it back up. So it could be weeks before you can even get in there to get the swelling down and get the compartment closed.
So how do they do that, Doc? How do you like open up a wound and then keep it open?
You maintain a dressing on it. You maintain a sterile dressing and sterile packaging in it to maintain the wound from having an infection. You also put the person on antibiotics to make sure you prevent infection. Once the tissues are not swollen and the compartment pressures are going down and you're able to approximate the skin, then you go ahead and close up the skin over the compartment. But it can be a period of days, sometimes weeks, before you're able to get the swelling down to be able to approximate the tissues.
So you're staying in the hospital, like you're not leaving, right?
Yeah.
You're staying in there. And my God, so how often do you have to change that dressing? Like
those dressings are usually Yeah, they're usually changed on a daily basis,
Okay.
just to make sure that everything stays nice and clean.
Wow.
And make sure the person is in a sterile, clean environment.
Yeah,
So
of course.
got to make sure that there's no infection there. But pretty much on a daily basis, those dressings are changed.
That is wild, Doc. I mean, that's not something. I mean, again, I'm not a medical professional by any means. That's why we have you as the expert on the program, my friend. But that seems pretty intense, kind of out of nowhere. And not again, I don't think it's that much of a common injury. I don't think a lot of people. I mean, we talk about obliques and high ankle sprains and concussions all the time. Like we don't really hear about compartment syndrome all that much. How prevalent is that? Especially in professional athletes, because again, I've been covering sports for over a decade now, and I've heard of thoracic outlet syndrome and a lot of different things that may be a little less common, but something like this, man, how rare is it?
I mean, it's not very common in sports. We usually see it in big traumatic injuries, like it's very common in, say, car accidents, or very common in significant traumatic injuries where there's a significant fall, a significant bruising and soft tissue injury associated with it. Now, can you see it in a sport like football? Absolutely. You catch a helmet to the thigh, you catch a helmet to the lower leg, and it causes a significant amount of bruising within the compartment, within the tissues. Eventually, what happens is that swelling continues to compound itself up until the point, again, it overcomes the circulation and you have compartment syndrome. So what we look for is usually paresthesias, meaning numbness, tingling sensation in the area, pain out of proportion to the type of injury. So it becomes very painful. When you do motion,
more than just the usual,
more than just the usual. Yeah. When you try to move the extremity, it becomes very painful when you do what we call passive motion. So me moving the joint or moving the extremity becomes excruciatingly painful. Things eventually will turn purple. Eventually will go pale. Eventually you lose your pulses. Once you start getting to that, you're kind of running behind the clock. So you got to try to start to identify things a little earlier, because once you get to the loss of pulses and the loss of circulation, you're kind of a little bit behind.
Unbelievable, Doc. Well done. Travis Hunter, I want to ask you about him because I know a lot of people were excited about him going into the season, playing both sides of the football for the Jacksonville Jaguars. He's out for the year. What do we know about his injury? And, you as a medical professional, how difficult is it going to be for him, do you think, to try to play on both sides of the ball at the National Football League level? Because I think what people don't end up really talking about, and nobody wants to talk about because it's such a manly sport, like guys need to rest. Guys need to relax, right? That's why everybody, it's not prevalent to see guys play both sides of the football. So what do we know about his injury? And also, like, from your expertise, like, do you think he's going to be able to pull this off and play both sides of the football?
Yeah. So it was a practice non-contact injury. First, when I read that, I'm thinking he blew his ACL. Right. That's the more common non-contact injury to the knee. But then as I kept reading and researching into the injury, it's actually a lateral collateral ligament tear. So that's the ligament that runs on the outside of your knee. So I got my little knee model right here.
Oh, here we go.
And basically, it's, let me see if I can.
You got the white background, so it's tough to tell. There you go.
It's this ligament right here. So this is your knee model. So this is your kneecap right here. So it's this ligament right here that runs between your fibula and the outside of your knee. Wow. So he blew this ligament right here. So basically, that's actually not a bad injury, especially because he didn't have any other injuries related to it. So they'll just reconstruct the ligament. Now, there's two possibilities when it comes to the tearing of that ligament. Either a volcet, meaning the ligament came off the bone with a piece of bone attached to it. And what they will do is they will take the bone and tack it back down with a screw where it belonged, and the ligament is intact and it's its own ligament. So that's the ideal scenario. The ligament itself didn't tear. It's just a volce off the bone, and we just got to put it back in. If the ligament torn, then we have to go ahead and rebuild it. It's usually rebuilt with tendon. It can be what we call peroneal tendon, semitendinosus tendon, patellar tendon. So it's rebuilt. So basically, you put a hole on each side of where the ligament used to be. You put the new ligament through, and you attach it with a couple of screws into that area. Recovery time, 6 to 9 months. You could brace to support the repair as he returns to sports. So I'm pretty sure he's going to come back and be able to play both sides of the ball again and be able to have a career and a future like he was going to have pre-injury, because this is certainly not a major injury to the knee. he'll have a reconstruction done, and he should be back without any problems.
One of the big injuries that we're seeing in the NBA, Bradley Beal is going to be out for the year with the hip injury there, Doc. It's a hip injury. You think about hip injuries and you think about, those guys in their late 30s, and it's like, man, I mean, these are so debilitating, especially the stop and start to these NBA players. What do we know about this injury? And was there any way that he could have done anything else to be able to kind of come back this year, or this was really the last case scenario? Because from what I'm reading, like they got multiple opinions on this.
Mm-hmm. Yeah. So he was dealing with a knee injury. He was recovering and coming back from the knee injury. And then all of a sudden he developed this hip pain, and they looked into it and they found he had a hip fracture.
Oh,
now when I first read that, I'm thinking he had a stress fracture, maybe a stress injury to what we call the femoral neck, which is the connection between the ball and the rest of your thigh bone area, right up between the socket and the bone itself. There's the femoral neck, and that's an area usually of stress, so you can have injuries there. You worry about blood supply to that area, so usually you have surgery for it, especially if it's on what we call the tension side of the injury. But then as I'm reading about the injury, I read that the surgeon said that this is usually an injury that is seen mostly in car accidents. So if that's the case, the most common injury, that hip fracture you see in car accidents, is an acetabular fracture, which is actually the socket breaks. We usually see that in car injuries because as you're driving and there's an impact, your leg gets driven by the acceleration and deceleration into the socket, and it breaks the socket.
Right. Okay.
So I'm thinking he had some sort of landing injury, or maybe there was a little bit of stress going on in the socket, and he landed at one point, and that caused a stress injury to the acetabulum, which is the socket. Most of the time, those injuries are treated without surgery, but without surgery, there's usually a higher chance of developing arthritic and degeneration of the joint later on. So usually then you opt for surgery to make sure you get the best outcome. And him being an athlete, it's basketball, a lot of jumping, a lot of hip stress going on. So I'm pretty sure that we're looking for different opinions to say, should we let it heal without surgery, or should we go ahead and have surgery and try to get a little better outcome from the surgery than without, and prevent further decay and degeneration and injuries to the hip later on. So I'm thinking that's where they sought all the different opinions on it to make sure that they had make the right decision. So they decided to go ahead and have surgery done, which is basically going to be a repair. They'll put a little bit of a plate there to make sure that you repair that area, and then make sure that he recovers well from it. So he's out for the season. He should be able to come back once the surgery and the recovery process goes through, which probably will be anywhere from about 9 to 10 months. I should be able to play again next year.
Quality of life too, right? I mean, I think with an injury like that, when you talk about arthritic, I mean, this is far past your NBA days. Doc, before I let you go, just a random question: who's your favorite athlete of all time?
Michael Jordan.
I thought it was going to be somebody else, maybe a different sport, but why Michael Jordan?
I went to medical school in Chicago, so I had the privilege of seeing Michael play, and I was a big Bulls fan when I was there. I was there for the first 2 championships the Bulls had, and that was my sport growing up. That's what I played growing up, was basketball. So getting to see him play and his competitive drive and everything that he did on the sport, I mean, to me, he's still the greatest of all time when it comes to basketball.
What about as a kid? Who were your favorite athlete?
Oh, my favorite growing up as a kid, there were a lot of local basketball players in Puerto Rico, but when it comes to maybe someone you would know, Roberto Clemente.
Oh, come on.
Baseball.
Better than that. Doesn't get better than that, buddy. Number 21, unbelievable. Still, in my opinion, one of the best players of all time. Right fielder for the Pittsburgh Pirates, man, and unfortunately we lost him on the plane ride to Nicaragua, bringing food and supplies to people that were in need there. Incredible, absolutely incredible. Just like you, Doc. Let's get to some of these comments before I let you go. How to watch my childhood favorite team beat my current favorite team. Hello to Doc Rodriguez. I love this segment. That's our guy Chan as well. Thank you for the super chat, as well as Rolly. Best segment in sports radio. This is elite level convo right here. This is really, really good stuff. And how about this? I Shine 813. I'm actually on my way to Blue Ridge, Georgia right now, up in the mountains. Small world. Doc, always appreciate your time, buddy. Thank you so much. This was fantastic, especially the discussion on Oliver Bjorkstrand compartment syndrome, man. I mean, that's not something we definitely hear very often. You're the best, my friend. We'll talk to you next week.
Man.
Have a great weekend,
Always
buddy.
a pleasure. See you next week.
Thank you, buddy. Wow, unbelievable. I always want you guys to be cognizant of, we have these conversations, and Ian and I have had this talk before. Whenever you're in the presence of something that moves you, whenever you're in the presence of something where you feel enlightened, hold on to that, recognize that, try to duplicate and replicate that. And the same feeling I get like when I walk out of the room after talking to Tony Dungy or Derek Brooks, I have that same feeling after I talk to Dr. Rodriguez. I know we're just talking about sports and I know we're talking about medical, but I feel so enlightened. And I think a lot of it has to do with just the kind of person. And guys, trust me. And a lot of people ask me, when you interview people, when you're around people, are they like that in real life? I can tell you, because I went to Evara Health a couple of weeks ago to hang out with Dr. Rodriguez, and he looked at some of the stuff that I had going on. He is the same guy. He's just an unbelievable human being. And he just makes our show a whole heck of a lot better. Always. And look at what Richie had to say here. As always, good stuff with Doc. I mean, think about that detail that we just talked about with Oliver Bjorkstrand and that injury. And Eric tells us about that scar. That's crazy, man. That is unbelievable. Yeah. Raise your hand if you heard about compartment syndrome before today, right? Like I heard it because of Bjorkstrand, but man, just the level of detail that Doc goes into. And the one thing I love about talking to Dr. Rodriguez is, and I know a lot of people out there can understand this, when you talk to somebody and it's their field and they're the connoisseur, they're the expert in it, and you're not, sometimes it's hard for people to be able to articulate what's going on and to get you to understand it without it going over your head. I say that sometimes to people that don't know anything about sports. And I try to talk to them and they're like, dude, I don't know what an inning is. What is a hat trick? I have no idea. And you have to get it to a level of like where they understand. And I don't like when people say dumb down. I think I'm not trying to say it like that, because listen, we all have these different things that we're passionate about, that we're knowledgeable about, that we went to school for. And I love the ability to talk to Dr. Carlos Rodriguez every Thursday on our Evara Health Injury Report, because when he says these things, I understand them. And I think outside of sports, sometimes I get a little bit discombobulated and I can't sometimes retain the knowledge as well as I do when I'm talking about sports. But I'm able to kind of ingest this information and to be able to rationalize it and be able to compartmentalize the information, even though it's a lot. And there's a lot of words that we don't know when it comes to the muscles and the tendons and the ligaments and things like that. But man, I think that's the reason why this segment has gone so well. And you see the comments that we have every week. And I get so much great feedback when I post it on social media of this is such a good thing. Not just because it's entertaining, not just because Doc is a good guy, it's because you love to hear other things about sports. You know, when we get into the habit, when we're talking about sports on radio and TV, when everybody's yelling and everybody's loud and everybody wants to say crazy things and have these hot takes and things like that. I've never subscribed to that. I've never thought that is what makes sports talk good. I think something like that is the proof is in the pudding right there. Don't tell me that things that are educational can't be informative and can't be fun. Like that's a lot of fun. Like I hope you guys have as much fun. And we see our viewership go up every single week when Doc is on with us. And we see all of the feedback. We don't get more feedback on any other segment or any other guest like we do with Dr. Rodriguez. And it's all good. It's all fun. Everybody wants to know. Everybody loves it. And that I think we should all understand. Going back to when I started talking about this, when you're around people like Dr. Rodriguez, when you have segments like this, when you have things that make you feel good and make you feel whole and make you feel smarter, because remember, in one day, you can't get bigger, faster, and stronger, but you can get smarter. And my goodness, I feel a lot more intelligent having Dr. Rodriguez here on the show and talking to us about all these different types of injuries. I wish I had some kind of medical background before I got into covering sports. I wish I did that. I wish I had more of a law degree. I wish I studied meteorology a little bit more. But my goodness, man, what an impact that he's had on the show. So, Doc, I love you. Thank you so much, my friend. Have a wonderful rest of your week. Guys, make sure evarahealth.org, buddy. evarahealth.org.